Thank you for your interest in our association's vasectomy services. Before you decide to proceed with vasectomy, we hope this video will provide you with the information you need to make this important health decision with confidence. A vasectomy is a safe and effective form contraception for men with a failure rate of 1/2000. As a permanent procedure, it is important to note that it is irreversible. Therefore, you should carefully consider other alternative contraceptive options before deciding to proceed with a vasectomy. There are many types of contraceptive methods available, such as male condoms, female condoms, oral hormonal contraceptive pills, hormonal contraceptive injections, intrauterine contraceptive devices, contraceptive implants, etc. Each method has its own benefits and risks, so it's important to choose the one that best suits you. Vasectomy is performed under local anesthesia in our day procedure center. The doctor will first disinfect the surgical area and administer local anesthesia. A small incision is then made on either side or the middle of the scrotum to access, and cut a segment of the vas deferens on both sides. The cut ends are sealed to prevent sperms from passing through. Finally, the skin incision is closed with sutures, completing the procedure. As the vas deferens are the tubes that carry sperm from the testes to the urethra. The principle of vasectomy is to cut the vas deferens, thereby preventing sperm from being released during ejaculation, to achieve contraception. Under normal circumstances, the procedure takes around 15 to 30 minutes. Clients are usually able to be discharged on the same day. There will be 1 or 2 small wounds on the scrotum, and the follow-up appointment will be scheduled for 1 week after the operation. Generally, clients can resume simple daily activities after resting for 2 to 3 days. However, it is advisable to avoid sexual intercourse and strenuous physical activities for 2 weeks after the operation. After the surgery, sperms may still remain in the vas deferens, which takes around 3 to 6 months to be cleared. Therefore, it is crucial to continue using an effective contraceptive method after the procedure. You will need to return for 2 semen analysis tests, scheduled for 3 months and 5 to 6 months after the operation. Contraceptive methods should only be discontinued once the absence of sperm is confirmed in both semen analysis. Vasectomy is a relatively simple procedure. However, like any surgery, it carries potential risks and complications. After the operation, some clients may experience mild pain, swelling, or bruising in the scrotum, which typically resolves on its own within 1 to 2 weeks. Additionally, there can be more serious complications such as wound or scrotal infection, hematoma, sperm granuloma, chronic testicular or scrotal pain, etc. Rest assured your sex drive, erection, and ejaculation will not be affected. If you have the following conditions, please contact us via 2919-7771 or attend nearest accident and emergency departments for urgent medical advice. Pain and swelling suddenly gets worse or show no signs of improvement after a few days. High fever. Notice blood, pus, or liquid leaking from the wound. A lump appears around the testicles and getting bigger. Now, let's talk about the application process. After watching the video, if you want to apply for vasectomy in our association, you can call 2572-2222 or go to the Family Planning Association for Hong Kong website to book an appointment to see a nurse and doctor for assessment. We encourage you to take some time to carefully consider your decision and discuss it with your partner. Therefore, we will schedule the appointment 2 months later. If you're married, bring your wife on the assessment day to review the operation details together. Remember to bring your ID card, marriage certificate, and birth certificates of all children. On the date of consultation, the nurse will check if both of you fully understand the essential information regarding vasectomy and its post-operation care. Additional information and counseling will be provided if needed. The doctor will evaluate your health condition and relationship to determine your suitability for vasectomy. If the consultation determines that you are suitable to undergo vasectomy in our association, you can schedule the operation and pay a deposit. Please understand that the operation date will be set at least 3 months later to ensure ample times for thorough consideration. On the date of your surgery, please set aside 2 to 3 hours at our day procedure center, while the vasectomy itself typically takes about 15 to 30 minutes. This time also allows us to prepare you for the procedure and monitor your recovery afterward. You will be able to go on the same day. The number of sick leave days granted will vary based on each person's specific circumstances. 1 week after the operation, you will be scheduled to return for a wound assessment by a nurse. If the wound is in good condition, your next visit will be for semen analysis. You need to submit 2 samples for analysis at 3rd and 5th to 6 months after the operation. If both semen analysis show no sperms, the vasectomy is deemed successful. Our vasectomy is offered as a package, which includes 1 pre-operation consultation, 1 vasectomy under local anesthesia, 1 post-operation follow-up, and 2 post-operation semen analysis. On the consultation day, you need to pay the nurse and doctor fee of $430. If you are deemed suitable for the surgery, you can schedule the operation and pay a deposit of $3,300, which includes a non-refundable administrative fee of $300. On the days of operation, you have to pay the remaining balance of $4,920. After the operation, you don't need to pay for the wound check and for the 2 semen analysis. Finally, we want to emphasize that vasectomy is a permanent and irreversible procedure. It is a significant decision for you and your family. We encourage you to have an open and thorough discussion with your partner to ensure you both reach a mutual agreement. While you consider your options, you may want to explore alternative contraceptive methods. Please take your time and avoid rushing into an irreversible decision. Thank you for watching. We hope you understand vasectomy better after watching this video. If you have any questions, feel free to reach out and discuss with us. If you are interested in applying, please call 2572-2222 or visit our website for booking requests.